Welcome to another episode of the Gestalt Education Show. I'm Taylor Premer here with my host, Dr. Brett Winchester as well. And today we're doing episode number 2 of our Clinical Savant series. So today we are lucky enough to be sitting down with Dr. Dave Juehring of the Palmer College of Chiropractic. So Dr. Juehring is an Olympic Bobsledder. He's a professional actor. He graduated from Palmer in 1994. He is now a DNS international instructor. And one of the coolest things is he is the director of rehab and sports injury, and also the director of the rehab residency at the Palmer Chiropractic Clinic. So, Dr. Juehring, thanks for sitting down with us, and we're really lucky to be sitting here. So, what I think we want to start off with today is, can we just kind of reflect on Palmer, the history of Palmer, and kind of where it started and where it's at now, and kind of the influence that the history of Palmer University or Palmer Chiropractic has really had on you as a human being and you as a chiropractor.
Yeah, as for myself, I've always been fascinated with the human body, and I've always liked a natural approach to that. So chiropractic to me was a great fit. I had numerous injuries. I was a track athlete at one time. Injured my back in a weightlifting accident and tried all of the different approaches, and then eventually tried chiropractic care, and then I had great success with it, and I was able to finish off my career as a discus and shot thrower. Mm-hmm. So,
yeah, that's great.
So it's been a good fit.
Yeah, no joke. And then, then graduated from Palmer, and now being on the admin team as well as the clinical team. Mm-hmm. How has it changed since maybe you were in school, and what's going forward? What's the direction of Palmer?
So when I was in school in '94, rehab was not relatively mainstream within the clinic system. Integration with other healthcare providers was not really a strong suit of what we did, but currently we have 3 of us that work in the rehab department, full-time chiropractors. We are the first and only rehab residency, so we've graduated about 7 rehab residents, and that's roughly 2 to 3 years per resident. So there's been a big movement for being more mainstream, and when I say mainstream, we're well accepted, but also co-management with other types of healthcare providers. That's more commonplace than it's ever been. You see that in the clinics. You see that in our school. Our chancellor's, Dr. Marchiori, has said our school is to be the best higher education school in the United States that just happens to teach chiropractic versus being the best chiropractic school.
He's a famous DAC bar too.
Yeah. So it's been a great movement in that way, and we haven't lost our identity as chiropractors. I don't think you'd find anybody in the facility that wouldn't appreciate what we do from an adjustment perspective.
Sure.
The difference is, though, that we co-manage with orthopedists, we co-manage with GPs, we work with all those groups. I mean, doing blood work, MRIs, the X-rays, all diagnostic ultrasound. I mean, even in our facility, that there are so many chiropractic patients and the docs that work with them that we co-manage with the rehab perspective. So,
Dave, there's some amazing stories of I think it was mostly BJ and rehab and Palmer here that no one really knows about. As time's gone on, I think everybody is led to believe that the Palmers were, basically straight chiropractic, only about the adjustment. And then the more you learn about the history here, you learn that rehab, even like what we would consider now functional medicine, they were really into overall health and maybe called it something different. But I'd be interested to hear what you have to say about the rehab room that BJ, was it BJ or was it?
Yeah, BJ.
BJ, yeah.
Yeah, BJ's rehab facility was roughly 1/3 of the total clinics.
Wow.
Yeah, so it was quite a big facility. And, when you look at the pictures nowadays, you may say, wow, that kind of looks a little, bush league. But the reality is, if you look at what's in that facility, that was state of the art of what they used then. And in many ways, you think, well, there's a lot of those things. If you had them in your facility, you can make them work and they would do a good job.
Yeah.
So they were quite integrated using rehab as part of their care. They were quite integrated as in their connections with Mayo Clinic and many other psychological wards and all of that throughout the Midwest. So they
kind of biopsychosocial before.
Yeah. They were into all of that stuff.
Wow.
And then through time, I think, which makes sense, is there was the fighting for the identity, and you remember all the many lawsuits that came out about chiropractic care, and so there was that big fight for identity. And I think it was important for us as a profession to know what we were.
Yeah.
So I think there was a movement away from that. But now that I think that we chiropractors we are not alternative medicine now. We are the group, so to speak. But I think that's where we know what we are, and we're comfortable with what we do, and that's where I think there's this reintegration of rehab, this reintegration of co-management. So it's been more of a evolution through the process. But yeah, it's Palmer is in all the other schools. We're in the Department of Defense. They're in the VA. Chiropractic care is so common. Brett, perfect example. You were with professional athletics, and myself, I was with some amateur athletics. But it's rare that you can't find a chiropractor at any major professional sport or any major amateur sport. There's a chiropractor involved with it because part of the big benefit of what we do is that we enhance performance drugless.
Yeah.
Which is great.
Yeah.
How does the present day chiropractic college reconcile the philosophical chiropractors that have been there before, maybe they're making donations to the school, with this new contemporary chiropractor, which is just, mastering all these different things and really kind of moving the profession forward. So, as a profession, how do we continue to bridge that gap? And do you have any thoughts about what you guys are doing here at Palmer to bridge that gap?
We do have quite a few chiropractors that, as alumni, come back to the school, and it's quite refreshing to see how strong their chiropractic approach is and their education processes that they use with their patients. But I think there is beginning to be that strong connection between all of us, that it's not a them and us, it's more of them and us, it's more of all of us together. So I don't think that divide is as strong as it once was perceived.
Right.
Sure.
Yeah, so I think I think we're beginning to realize, hey, we're one big team and we have many different facets to it, but we all have the connection of what we are, and that's chiropractors.
Sure. And I think too of Brett and I have said it multiple times, and we had our first clinical savant was with Dr. Morgan from Parker, and a lot of people are ashamed to say that they're chiropractors, but I think maybe Palmer's roots in us, we're very steadfast in the fact that we want to be called chiropractors, and that we're very proud of our history and our heritage. And so and going back to the history of Palmer, I think that maybe is kind of what you're getting at, is not being ashamed of that and being really good with your hands and doing those types of things kind of can help bridge that gap.
Yeah, you touched something about being good with your hands. I also think as chiropractors, and it's been fleshed out in the literature, we're better communicators to our patients of explaining, this is what you have, this is what we're going to do. Yeah. And whenever you put your hands on somebody, there's a therapeutic benefit to that. So I think those are just some strong suits to what we do. And, from an athletic perspective, since we have so many chiropractors involved in those arenas, it's because we can enhance performance. And when it comes to many patients, if you really begin to think about it, a good friend of mine is a chiropractor who is in charge of 200 of the physicians at one of our local hospitals. And he's brought this up too, and that is our education to touch and communicate and our skill sets set us apart because we can logically think. And where can you go where you can go into a office and leave better than you were before?
Yeah.
Right.
And that's really what we do well.
That's a really good point.
Yeah. because it's it's we can change somebody relatively quick, and that could be maybe the very first visit or the second visit, but people come to us because they can see a change, and we can see a change relatively fast. So
yeah, absolutely.
So a lot of Fortune 500 companies, they look for Division I or collegiate athletes because they know the same qualities that make you a top athlete can also make you successful in the business world. So we're curious on, you were an Olympic athlete, which is unbelievable. Not many people can say that. So how much did that help you as far as being one of the best clinicians and things like that? Like, how much was that helpful in this journey that you've been on in chiropractic?
Well, one of which I'm still learning a lot. I don't know if it was the Olympic aspects or if it was just that I was one of those that always believed to give it your best. If an instructor said this is what's on your exam, well, then that's what you did. My undergrad program, I remember it was a strong engineering school, Iowa State, and they basically said, this is on your tests, study everything and all of it, and that was just what I did. It was just that work ethic. Now, whether I had that before or after, but that's carried through from my academic career to my chiropractic career to my sporting career to all of those things, and that is just strive to continually get better at what you do.
Right.
Yeah.
To me, that's what you do.
Yeah, right. Talk about, so you're an international instructor for Dynamic Neuromuscular Stabilization, so that's one of our core fours. So how is Dr. Kolar and the Prague School kind of influenced your education track at Palmer and what you kind of try to pass on to your residents? And
for many years ago, there was Yanda, who's known for his upper and lower cross, and I'll never forget that he was the one that had mentioned, hey, there's this new guy coming along, his name's Kolar. And he's kind of integrated all of these things together. And I'll never forget, and I believe you were probably there or at one of the first classes with Kolar, where it was just this pretty wild stuff that he was showing us. But right out of the blocks, it was one of those things that was kind of the glue that the chiropractic model fit in. And for those of us that learned PNF diagonals, that fit in. And for those of us that knew upper and lower cross and helped teach some of that back in the early days, there was this, what's the connection? And it was this respiration thing. So even from just a general strength and conditioning perspective, there was this glue of what's the commonality of what it was, and that's what kind of drew me towards the DNS model. And painstakingly went through the evolution of all that, right, Brett?
Oh, gosh.
Yeah. I mean, considering full check and you had no clue and you're taking
no notes, no translator,
no nothing. So that is involved a lot. But just that general concept is always that kind of grand unified theory I've liked about the DNS model. Hence, I've pursued it all these years and trying my best to become really good at it, which Brett will tell you, it's a continual process.
It's like looking out in the ocean, isn't it?
Yeah. But so that's been that commonality. And regarding the students that we have in the clinics and predominantly in our rehab department, that is the backbone of what we do. And it may not look like a DNS exercise, but everything from understanding how a person develops stability and how someone can decay to knowing how to use open and close chain and joint centration and joint differentiation. All of those things permeate what we do. Yeah. But it may be a ADL activity that it gets fleshed out versus a traditional DNS exercise.
Well, my co-host here, Brett, he's got the quote that I always remind everybody of is that any exercise can be a DNS exercise if the principles are adhered to. And so that's just like a prime example of how that integration can happen.
Well, even like this weekend, we're here for an NPI seminar, and So we're going to be teaching the students how to joint play and how to do manipulation and things like that. But the overall picture will be, from a DNS standpoint of why the joints get blocked.
Exactly.
So it's one thing to be able to feel it. The thing that, a lot of people miss is by the time a joint gets blocked, you're probably dealing with something that wasn't originally being stabilized in the right way. So
Correct.
When we're able to integrate manipulation with, for example, DNS principles, you just literally have the keys to the castle. It's the most powerful combination, one of the more powerful combinations.
And that's our we have 10 trimesters, and we really like to work with the students from 7th try through 10th try, because they finally get to a point in 10th try where you can really, really put the pieces together, and they can understand the idea that, you may palpate somebody's foot and feel a fixation, and you may traditionally go after that from an adjustment perspective, but it may be, let's have them pressurize correctly, now check the feet, and all that stuff's gone. Which is where it gets into this idea of we really want to have the students a little bit longer during the 10th try, so we can teach them that really this developmental model is insightful to what we do as chiropractors.
Yeah.
And that is, it can begin to explain a little bit more of what we're really looking at.
Sure.
Is it truly a problem of the foot, or is it truly a problem of the system in general? And if you get back to the philosophical aspects of chiropractic, it's more of a CNS driven. Well, the DNS model, in my eyes, explains a lot of what we do as chiropractors a little bit better than this biomechanical perspective.
It's neurophysiologic. Yeah.
Right.
Absolutely.
And that is, if you truly understand that developmental model, in my eyes, it explains that facilitation aspect that can cause a fixation or a subluxation. Yeah. And that is, you may be not needing to adjust. You may need to do more stability somewhere else to solve a problem remotely.
Right.
Yeah.
Well, even like tomorrow too. One of the first things we'll do is the chiropractic students will learn how to generate intra-abdominal pressure in their own bodies to be great at the skill of manipulation.
Exactly.
So it's not just about what we're doing to the patients. It's also like having the forces right in our own body. Therefore, we can be quick with our hands, and no one ever thinks or talks about that. But
just the ergonomics of being a chiropractor.
Right.
Sure.
Longevity and absolutely.
A lot of the students that are have pretty good knowledge of DNS will watch me when I'm treating, and they'll see what a big nerd I am, because I'll put my hand on my side
and make sure you're
pressurizing, drop the shoulders. But I'm one of those nerds that actually practices what I preach.
Yeah.
But through all of those little nuances of time you have to yourself, sometimes you can figure out these little things that help not only me, but I can apply that to a patient and be like, that's what problem at.
Yeah. Oh gosh.
Have you ever thought of if Dee or BJ walked on campus today, would they be proud? What would their thoughts be? What do you think?
I as a chiropractor, I would hope they would be proud of the educational aspects of how we teach a student, how we develop the skill sets of being a chiropractor. So I would hope that they would be proud that we're doing a better job of, so to speak, producing a chiropractor. And I would hope that they would be open-minded in the way, more like BJ of, let's work together.
Right.
Integration,
the integration aspect of it. So I hope.
Yeah, it was interesting. My good buddy, and I know you know him too, Dave Seaman, he always presents, and he's got a slide that showed BJ basically saying that he did not believe in long treatment plans, which I think also is interesting. Like, it always is, at least my students at Logan were always like, really? Like that? They're really shocked to hear that also, besides seeing the rehab pictures and posters, which I think we'll attach on the...
On the video, absolutely, yeah. So we're lucky we're in Davenport, and so Davenport Palmer has a brand new clinic. They've got just an amazing space here, and so we'll highlight some of those in the video portion and through social media and stuff like that. So they're doing amazing things. So.
Yeah, they're continually improving the campus, while there's the parallel of improving us as educators and processes, so we can help the students become what they want to be either quicker and or more depth to what they do.
Yeah.
This is a chance to give Palmer a plug. So if you were a student, you were kind of contemplating where you wanted to go to chiropractic college, give the listeners a couple good reasons why Davenport, where it all started, would still be a good place to be educated.
Well, I know one thing, they shouldn't go to Logan, right? No. You know, they're all good schools. They all have their strengths. I think one thing that Palmer Davenport is very well known for is that we have strong adjusters that come out of the clinics systems. And part of that, I think, has to do with how much adjusting is still part of the curriculum. I think also due to the fact that there's a strong club system at Palmer, which draws in a lot of good speakers, hence you guys coming in to the Quad Cities this weekend. How's that? So I think that's good what we have. It is very ironic that Palmer has really the only rehab functioning facility within a chiropractic clinic in a school, which kind
and
of
you're
odd.
in charge of that.
Yeah. I don't know how that happened, but I'm still alive. But
I'm very, very burned.
Yeah. And again, the odd thing is we're the only people with a rehab residency. So
there's some irony to that. I mean,
that is considering
cool.
you know,
cool.
when the school was what I'd say not real pro integration, that we had a rehab facility with many clinicians and residents. But
did he just say integration?
Yeah.
That's our key word. Yeah.
But no, I think Palmer Davenport, you know, we're striving to be the best higher education college in the United States that just happens to teach chiropractic. And we obviously are a little biased. We have a functional rehab department where you will learn to do rehab and chiropractic together in one facility, which is nice. And we're strong adjusting background from Palmer.
Yeah.
You know, it's funny, I forget about this. We have a strong philosophy here too at Palmer. It's part of what we do, and I just never think about those things. But it's just part of what we do. So, but they're all good schools.
Yeah.
You know, one nice thing about Palmer Davenport and Logan and maybe Northwestern and National, you got those northern states when it snows and you got nothing else to do but study. So
that's right.
That's one good advantage, right?
Did he leave out Cleveland?
He
Are
left
you
out
offended by
Cleveland.
that?
I'm a Cleveland grad.
Yeah. Forgot about
Carl would be so upset with me if I didn't say that.
Yeah, but you guys are a little more southern and you get a little more of that warmer.
Good cover.
That's true. Well, Dave, you said it perfectly. Integration, and that's really what Gestalt is. The whole meaning beside Gestalt is integration of multiple ideas and multiple different philosophies into one amazing patient encounter. And so that's really what I think I've really taken away this conversation with you, is that more and more now than ever I have more hope after talking to Bill Morgan, after talking to Dave Juehring, that like our schools are progressing and they're progressing in the direction of integration, collaboration, and really including everybody in the healthcare system for a really good experience for our healthcare.
And that doesn't mean we lose our identity in any way. I mean, many of the patients that step in our department, we know the literature, we know the experiences with our patients. I'm not anti-surgery, but we solve a lot of cases where they don't go to surgery.
Right.
And the surgeons around the Quad Cities will tell you, especially the spinal surgeons, go to Palmer because we don't want to operate on these people until they have exhausted all of these chiropractic care and some rehabilitative care and all of those things. Then if you've done that, come see us.
Yeah, you're vetting them out for that next.
Yeah. And which is where it's getting into why chiropractic's doing so well in the VA and Department of Defense, is because they're the front lines. You go see the chiropractor first, then you come, right, to whoever's next in line.
Right. Yeah.
So, which is nice. Which is a fully integrated. At the end of the day, it's all about the patient. It's not about me.
Yeah.
So if I always tell students, I don't expect you to be able to do post-surgical rehab. I expect you to understand some of this stuff such that even if you're an upper cervical only And that's cool if that's all you want to do. But you kind of know maybe this person needs a little of this or needs a little of that. And that's important.
I always tell my students too, the ones who are like philosophically driven, whatever their technique is, they're going to change that 10 times in the next 3 years.
Yeah, that is true.
It's so interesting to kind of watch. And I'm old enough now to where like I'll have students who are so pigeonholed into something, and then they come around to different ideas, and that's what makes it so much fun, you know.
A lot of our students that are athletic trainers before coming to Palmer, and then they come to Palmer, and they're like, "Oh, we're coming to Palmer. Look at this big rehab facility and all that stuff." The majority of them end up as upper cervical.
Right.
You know, so who would go figure? And then some of the people that are like, "No, I'm going to work with pediatrics," turn into rehab. So you never know. And
what's my joke with my everyone I recommend to go to Logan from my town, they all end up doing something totally different than what I do. You know, like they grew up with a patient of mine, they love it, they're on board, and that's kind of our inside joke. Yeah.
So what you're saying, you're not a good recruiter for Logan.
Indirectly, that's
come
exactly
to Palmer.
what I said.
Yeah, come to Palmer. Come hang out with Dave. So, well, Dave, what a pleasure talking to you. I know I took a lot away from this, and one thing I left out is that we're enjoying a really fun bottle of wine tonight as well. And so, our bottle of wine for our wine conversation is from the Shea Vineyard in Willamette Valley, Oregon. And so, Brett and I were lucky enough to hang out there and learn from the Shays themselves with Dr. Rich Ohm, and what a cool vineyard. Holy
we had a lot of fun there.
So great bottle of wine, but anyway, I just want to close with saying, Dave, thank you for pushing the profession forward. Thank you for staying in higher education, and not too many people in higher education are still seeing patients and still leading clinics and stuff like that. And so we really applaud you, because that's a difficult thing to do. I mean, it's not easy. So we thank you. Keep pushing the profession forward.
Yeah, and I treasure and value the friendship, and we've had a good ride with DNS, and it's been a lot of fun.
So maybe you and I can go teach in China.
I like it. Yeah, absolutely.
Or maybe not.
So anyway, with that being said, Dr. Juehring, thank you so much.
Oh, my pleasure.
And come hang out with Palmer, guys. It's progressing forward, and it's our top 2 or 3 schools for sure. So now that I know all that Dave's doing here, it might be creeping up there close to number 1. There's a good, healthy competition up top.
Let's go. So we're creating it.
Let's go.
We're getting everyone agitated. I love it.
Let's go. All right, guys. Well, thank you so much. And to find more about Dr. Juehring, check him out on the DNS website. Do you have any other social media or anything like that? Or
no, just probably the Palmer Clinic still. There'll be some
absolutely
spiels here and there.
I love it. All right, guys. Well, enjoy this conversation with us, and keep striving to be better in the clinic, and keep striving to do what's best for your patient that's in front of you. Like we talked about today, sometimes that isn't always with you, and sometimes the integration is the best piece you can do for that patient in front of you. So have a great day, guys, and we'll talk soon.